And are they being discouraged often by their family from even thinking about contraception? Or is that
yeah, I mean, many families, the conversation of sex is very hard for many families, and for Latina families that is the case as well. And oftentimes Latina parents, and we hear this from Latina parents, they're assuming the child is getting their education in school. And oftentimes schools are not giving holistic, comprehensive sexuality education. So access to that information and that education is really paramount to reducing the number of pregnancies. And again, we as an organization, we support the choice of having an abortion, and that's something that many Latinas also can't have access to because they're low income, because they're fearful, because there's no clinic in their community. New York State, women in New York State and Latinas in New York State do fare a little bit better. Right now, Medicaid does cover the cost for abortion. It's a state-by-state issue. Right now, there's a federal ban to use federal funds for services like abortion care, except in the case of rape, incest, or the woman's life is in danger. But New York State and several other states, about 17 other states, are able to use their own funds to cover that service. So, so we think about teen pregnancy rates. It's really looking at teen birth rates. So, you know, the pregnancy rates are higher, but also the birth rates are higher for Latina teens. So we have to think about what, you know, when they become pregnant, what are their options? They can choose to have the child or to have an abortion, and oftentimes they face barriers to that second choice.
And is one of the barriers, the second choice, a real hesitance about abortion among Latinas and Latinos?
Yeah, I mean, there's, again, abortion is something that's very stigmatized in many communities, and in many states, there's so many barriers, particularly for young people. There may be parental notification rules. They might have to go in front of a judge to bypass those rules. So that's something that many, if you're a young Latina that maybe is a new immigrant to the U.S., that's going to be a barrier to accessing that type of care, not knowing how to negotiate the system. So, so yes, it is challenging, and also, you know, I think when parents are assuming that their child's getting the full range of comprehensive sex education and information in their schools, they think they may not have to have those conversations, and oftentimes that information is not getting to the young people that need it.
So we need to focus more on the reasons. But I have the impression that, and is it true that those Latinas that do choose abortion will, because of various factors, will choose to back alley abortion rather than a safer procedure in a qualified clinic?
Well, sometimes if we have reports and heard stories of Latinas, particularly immigrant Latinas that are new to the U.S., that have gone sort of the back alley route, taking pills and taking other prescriptives to self-induce. However, the statistics are really challenging because it is sort of an underground procedure. What we advocate for is, of course, getting access to a clinic and access, you know, to doctors, and be able to get the full information about the procedure. So our organization is pushing to get rid of something called the Hyde Amendment, which that's the amendment that prohibits federal funding for abortion for low-income women, except in the case of rape, incest, or the life. So for many low-income Latinas, you know, the Hyde Amendment poses a barrier to accessing care, and oftentimes they may, you know, choose to take matters into their own hand, or they may end up having having the child, although it's an unplanned and unintended pregnancy. So we fight for their rights to be able to get, you know, not only have the legal right to an abortion, but also be able to access that right through public funding if they're low income and don't have the means to do so.
And what is the National Latina Institute for Reproductive Health currently doing that you would really like our Westchester audience to get involved in, to participate with you all? Sure.
As we talked about earlier, the contraceptive, looking at contraception as prevention in the healthcare implementation part, that's a campaign that we're working on. We really want to lift the voices of our communities and make sure that the administration hears that contraception is prevention. So we're embarking on a campaign. We're working with community organizations to write into the government, let them know that they're taking comments, right? So the period is going to be a number of years, so they're taking all this feedback into consideration. So ensuring that you hear from that folks are talking to their legislators about this issue, that they're talking to their health commissioners and other policymakers about the fact that they want contraception included as a preventative healthcare service. So that's a campaign we're embarking on, and we're working specifically with Latina women on that piece. We're also looking at immigration policy, quite frankly. Our organization, because we work on with immigrant women, we understand that immigration policy profoundly impacts immigrant women's ability to get abortion or reproductive health care. So there's a bill called the DREAM Act that would allow young...
I'm sorry?
The DREAM Act.
Oh, the DREAM Act, okay.
It stands for Development, Relief, Education for Alien Minors, which I don't like the word alien, but basically for undocumented young people who have come into the country and to be able to change their status so that they can go to college and they can enter the military if that's a choice that they want to make, and then not living in the shadows. So by them being able to become documented, they then can get the full array of services that are necessary to be healthy and contribute to a community. So that's a campaign that we're working on as well.
And then, where can we go after this program?
Sure.
I'm not sure I had the words to write a letter to the editor, for instance, or to really understand the implications of the DREAM Act. Where can we go for further information?
So our website, www.latinainstitute.org. We have a button there that allows folks to sign on to our e-newsletter, and we send updates on alerts and things that are happening, in addition to exciting news about the organization and the issues that we're working on. So that's a really one-stop shop to kind of get the information delivered to your inbox, and where you can take action from the comfort of your computer.
And how are you supported for all this wide array of activities that you're involved in? We
have wonderful foundations that support our work. We also have individual donors that support our work as well. And last year we just held our a 15-year birthday party, and we called it a quinceañera. It was a coming of age for our Latina organization, and that was also a big fundraiser for our organization. So we have many wonderful foundations that help us do and advance our work with the Latina community.
Excellent. Well, what the information that you have shared with us, I was asking you what the National Latina Institute for Reproductive Health does, and for Latinas, and the basic answer is you do a lot.
Yes.
Both in the community and in the policy advocacy in Washington. I invite my Westchester friends and neighbors to join us in attending to these very important issues that are particularly challenging for our Latina sisters. And I thank you very much,
thank you so much,
Jessica, for joining us on Future Choices tonight.
Thank you.
Thank you, and good night to my neighbors.